The adenoid gland is a small lump of tissue located at the back of the nasal cavity, above the tonsils. Adenoid gland removal, also known as adenoidectomy, is a surgical procedure that involves removing the adenoids. Here are some potential advantages of adenoid gland removal. Reduced risk of infections. Adenoids can become enlarged and infected, leading to conditions such as sinusitis, ear infections, and strep throat. Removing the adenoids can reduce the risk of these infections and their associated symptoms. Improved breathing. Enlarged adenoids can cause breathing problems, especially during sleep. Removing the adenoids can improve airflow through the nasal passages and reduce snoring. Inhaler use is increased when adenoid gland hypertrophy is misdiagnosed as asthma. The use of inhalers and breathing issues in children will end after an adenoidectomy. Better sleep quality. Sleep-disordered breathing, such as sleep apnea, can result from enlarged adenoids. Removing the adenoids can improve the quality of sleep and reduce the risk of sleep-disordered breathing. Adenoid gland removal can potentially improve oxygenation in some cases, particularly if the adenoids were obstructing the airways and causing breathing difficulties. When the adenoids are enlarged, they can cause nasal obstruction, leading to difficulty breathing through the nose. This can result in mouth breathing, which can lead to a decrease in the amount of oxygen that is inhaled. In some cases, this can result in a decrease in oxygen saturation levels in the blood. By removing the adenoids, the airway obstruction is removed, and breathing through the nose can become easier. This can improve the amount of oxygen that is inhaled, potentially leading to an improvement in oxygen saturation levels in the blood. Improved hearing. Enlarged adenoids can press against the eustachian tubes that connect the ears to the back of the throat, leading to a buildup of fluid in the middle ear and reduced hearing. Removing the adenoids can improve hearing. Improved speech. Enlarged adenoids can cause nasal speech, which is a speech disorder that occurs when the adenoids obstruct the airflow through the nasal passages. Removing the adenoids can improve speech quality. Tonsillectomy could be beneficial for IgA nephropathy patients, particularly by contributing to faster and longer remission as well as reducing the frequency of possible future relapses. However, tonsillectomy may not be enough and may not change the prognosis in IgA nephropathy patients with marked renal damage. It is important to consult with an ENT specialist to determine the underlying cause of breathing difficulties and low oxygenation levels and to determine the appropriate treatment plan. It is important to consult with an ENT specialist to determine whether an adenoidectomy is appropriate for your individual case. The best information is provided to you by the ENT clinic in Kandy so that you may make the best decisions.